Osseo Tap is the instrument which will allow you to determine the quality of bone. Lot of times what happens is we are only focused on the height and length, but we fail to understand that the bone quality can differ, which means that if I am drilling 20 mm, if the bone quality is poor, you may need a wider implant to get a higher insertion torque. But without the Osseo Tap, what happens is you will put a 3.5 implant, realize that you did not get torque, pull it out. When you pull it out, you've already created a 3.5 Osseo Tap. Because we don't want that error to come in the picture, especially for beginners who are finding it difficult at 10-15,000 RPM to understand and assess the quality of bone in the pterygoid or any other areas. This Osseo Tap can serve two purposes. One is when we place it, it will give you a judgment about the quality of bone, which allows you to determine what width of the implant to select, which I'm going to demonstrate. And second, it confirms in a flapless protocol you are in the bone. Because if you put this, you are not getting any torque. There is bleeding from the osteotomy. Patient gingiva is getting bruised. He may have discomfort also. All that are indications. Probably you are not even in the bone. Forget torque. Okay. So these are the uses of it. Now I'm going to demonstrate how to use the Osseo Tap. So once my drilling is done, I will place my Osseo Tap in the same osteotomy and watch out for two things. One is whether I'm getting torque. Second is at what depth I'm getting torque. At what depth I'm getting. Now see, my entire Osseo Tap is inside and I'm getting torque almost when the Osseo Tap is completely in. Now tell me, what does it indicate about the quality of bone? That means till approximately 18 mm, there is hardly any bone to catch the implant. After 18, 19, 20 mm, when I'm reaching the opposing cortical, there is some action. Right? Now, because the height and width is there, and if you want to use the cancellous bone as well as go and touch the cortical bone, I'll select a longer QoS implant diameter 4.1 in Impact R-Line series. Or I will abort using cancellous bone and switch to 4.5 BCS, thus engaging the cortical. You are able to make out the use of Osseo Tap, right?